So we have dealt regarding preoperative care, intraoperative care. Now next topic that we are dealing is post-operative care. So in preoperative care we have seen the care that is usually given before the surgery, and intraoperative care means the entire procedure of surgery. Okay, the care that is given during the time of surgery is referred as intraoperative care. And next now is post-operative care. So post-operative care, you can see the here in the figure. So this you can see a recovery room. Okay, recovery room is also called as post-operative ward. Okay, so after the surgery, usually surgery is conducted in the OT, in the operation theatre, or we call it as a operating room. Okay, so surgery is performed in the OT, and after that the patient will be shifted to post-operative ward, okay, or the recovery room. Sometimes it is also called as post-anesthesia care unit. So this is just a small image of the PACU, that is post anesthesia care unit. Okay, post means after the anesthesia. Okay, so you can see how we are. So in between the beds there are so many machines are there. Full monitoring system is there. There is a requirement of intensive monitoring in the post-operative ward. Okay. So that is why the patient will be shifted to the post-operative ward or to the PACU soon after the surgery. So this is the introduction. The aim of the post-operative care is to provide the patient with quick, painless and safe recovery. The patient has to recover quickly after the surgery. So we are keeping the patient in the post-anesthesia ward after the surgery. So once the person has recovered, okay, then we will shift the patient to the ward or maybe to the general ward where previously the patient was there, or to his room. There we will shift them. After that the patient will be discharged. But when the patient is in the post-operative ward, he will be stabilized there. Okay, once he is stable, then only we are shifting to the ward here. So next is moving on to definition of post-operative care. So post-operative period or post-operative care begins immediately after the surgery and continues till the discharge of the patient. Okay. So once the patient surgery is over, you will shift the patient to the post-operative ward where care will be taken. Okay, after the surgery, and then till the time of discharge, that is referred as post-operative care. In the post-operative nursing care, we have certain major roles to do. So major roles here are, one is protecting the patient. Next one is preventing the complications. Okay, we are protecting the patient in the sense the patient soon after the surgery, they may have lot of things to be monitored, maybe for blood loss, vital signs you have to monitor, then positioning should be monitored. So you have to continuously monitor the patient. Then next, what you have to do is preventing the complications. So lot of complications can happen after the surgery. Okay, immediately it can happen, or even after some time after the post-operative period, once the patient is going to get discharged, that time also certain complications can happen. So what you have to do is you have to prevent these complications. Next one is, what do you mean by PACU? I have mentioned this term. PACU means post anesthesia care unit. Okay, so immediately after the surgery, what the surgeon will do? The surgeon will shift to a recovery room or to a post anesthesia care unit where the post operative care will be provided to the patient. So that is referred as PACU. And this PACU location, where this PACU should be located now, most of the time the PACU should be located close to the OT or close to the operating room. Why it should be close to the operating room? Because once the patient's surgery is over, you can shift immediately. There is only one small corridor. Through that corridor, what you will do is you can shift the patient immediately to the PACU, that is the post-operative ward. You should see that PACU is close to the OT. Okay, and always you must know that PACU should be quiet. Why it should be quiet? Because the patient is resting there. You must not make noise. Okay. Next is there is restriction of the number of visitors also. Same like your ICU. Here also there is restriction of visitors. Every time you cannot enter, the patient party cannot enter the PACU. There is a specific time period where they can meet maybe, okay, after the surgery they can see the patients, but once they have completely recovered you will shift them outside, okay, into the ward, and see that the PACU is clean and free of pathogens, okay. Then as I have told, PACU is also called recovery room or the post-operative ward. So please note down this post-operative phase or the post-operative care is very important. Sometimes they will just ask, write the post-operative management of maybe appendicectomy, post-operative management of cardiac surgeries, something like that. Now overall the answer will be almost the same, okay. Answer will be almost the same. You have to just correlate and make some differences for different surgeries, okay. So see that it is the most important topic. Next is moving on to phases of post-operative care. So under the phases of post-operative care we have got immediate phase, intermediate phase and convalescent phase, okay. So immediate phase is phase 1, phase 2 means intermediate phase, convalescent phase is phase 3, that means after the discharge or after the recovery, that is referred as convalescent phase, okay. So first one we will move on to phase 1. So phase 1 means it is an immediate phase where you are monitoring the patient after the surgery. Okay, phase 1 means immediate phase after which you are monitoring the patient for the after which you are monitoring the patient. Okay, so most of the time immediately after the surgery intensive monitoring is essential. What do you mean by intensive monitoring? Intensive monitoring means continuous monitoring of the patient. Okay, now immediately when a patient is arriving from the operating room, you will have to monitor the vital signs. You are monitoring the vital signs means not just checking the vital signs once and then coming after 2 hours. Okay, in recovery room, every 15 minutes you have to check the vital signs. Sometimes you have to check the vital signs every 5 minutes until the person is stable. Okay, for up till 1 hour, maybe every 10 minutes you are checking vital signs. Then after that, every half an hourly, then every hourly you should check the vital signs and continuously monitor the patient. Okay, now the nurse must be very vigilant, not only monitoring vital signs like pulse, BP, temperature, respiration and all. The patient may be connected to the monitors here. Most of the time maybe cardiac monitor, or sometimes if the patient was given general anesthesia and there may be requirement of intubation, okay, where you will put the endotracheal tube for oxygenation. So patient may be on ventilator also. Okay. Now most of the time patients after craniotomy or after cardiac surgeries, it will take long time to recover. Maybe it will take around 3 to 4 days. Okay. So what you have to do is continuous monitoring is essential, especially ECG monitoring, pulse oximetry, ABG, that is arterial blood gas analysis. All this has to be monitored for the patient. Now, the goal of phase 1 is seeing that you are shifting the patient to phase 2. That will be your first main goal. But remember, in phase 1, you are intensively monitoring the patient. That means continuously monitoring the patient, because patient can go into complications anytime. Second one is phase 2. Okay. Second one is phase 2. Phase 2 is coming after phase 1. Okay. Phase 1 was immediate care. In phase 2, it requires less intensive care. Okay. Here the patient has to be monitored but not very closely. Okay. They have crossed phase 1, chances of risk is less, but you must observe the patient here. Okay, but need not observe continuously, or vigilant monitoring is not essential. Okay, after phase 2 what happens is, once the patient vitals are stabilized and the person is all right, you will usually move the patient to phase 3. Okay, so that is referred as phase 3, where patient needs to just observe. Okay, you have to just observe the patient. Maybe you are keeping the patient under observation. Okay, in phase 3. After phase 3, what you will do is you can shift the patient or you can discharge the patient. That is called as phase 3. Okay, so these are the phases. Okay, in phase 3 you are need to just observe the patient. It is called as extended care, where you will just monitor the patient when they are doing the self care activities and you are making them independent. Okay, so that these are the three phases of post-operative care. Next is goal. What is our goal? Now, first of all, our major goal should be to protect the patient and to prevent the complications. Okay, protecting the patient and preventing complications should be our major goal. Other than that, some other goals of PACU are promoting the respiratory function. Now, I told that patient can go into complications. It could be respiratory complications, cardiovascular complications, renal complications and all. So what you have to do? You have to promote respiratory function. You have to also promote cardiovascular function. You have to enhance renal function and you have to provide an adequate diet to the patient after the surgery, because you must know that soon after the surgery you will not get food to the patient and tell the patient sit and eat, because patient will not be recovering from anesthesia, especially your general anesthesia. Okay, so after general anesthesia usually what happens is patient needs some time to recover. Patient will get up from anesthesia. Once they recover from anesthesia, usually the patient will be nil per oral. Okay, nil per oral means you will not give anything orally to the patient. Okay, so what happens is during that time you will just have to wet the lips of the patient, okay, with just water. Then once their bowel sounds have written, okay, that is peristalsis has written, then only you can start with the oral fluids. Okay, so initially patient will be NPO. Then what you have to do is auscultate the bowel sounds and check for peristalsis. Then the surgeon who is there will tell start with oral fluids. Okay, first you are not giving solids. Remember, first you will start with oral fluids. Then you can start with the semi-solid. Then you can go to solid food. Okay, so these should be our major goals of PSU. Other than that, what happens is the patients may go into dehydration. Dehydration because they may not be taking food and fluids orally. So what you have to do is you have to maintain fluid and electrolyte balance. How you will do that? Most of the time you can do that by giving IV fluids. Okay, intravenous fluids can be started, and along with that you can usually start with total parenteral nutrition. Okay, that you will deal in GI system in detail. Okay, or what you can do is you can also monitor the electrolyte levels of the patient. Okay, electrolyte levels of the patients mainly include your this one sodium levels, potassium levels, chloride, magnesium level. All that has to be assessed. Next major goal will be adequate rest and sleep. Now, after the surgery, the patient usually has lot of pain. Okay, so what you have to do is assess for all these symptoms, and then you have to promote sleep and rest. Now next is what you have to do for post-operative care of the patient. So for post-operative care of the patient, first one is initial assessment. So initial assessment means what you are doing immediately once the patient is in the PSU. Okay, so once the patient is shifted to the post-operative ward, usually this order will be given by the anesthetist or by the surgeon. Okay, anesthetist will usually shift the patient to the post-operative ward, where the anesthetist usually will monitor the patient until he is slightly stable. Okay, so the surgeon will usually write some post-operative orders, for example, to start IV fluids, that order, or maybe to start with some medications, what wound care, certain things will be written by the surgeon. So all these post-operative orders have to be carried out. Okay. So before that, our priority usually should be to monitor the respiratory function, circulatory function, to monitor the vital signs and to monitor the site of surgery, because chances are there that there is going to be a lot of bleeding from the site. Okay, so continuously you have to monitor the patient and assess the patient, and also evaluate ABC, that is airway, breathing and circulation. Okay, and once you are doing initial assessment, you can always find out whether there is inadequate oxygenation or inadequate ventilation. Next is post anesthesia admission report. So in that you have to see what and all details are written about the patient. What is the name of the patient? What is the age of the patient? What the anesthetist has written? Okay, what type of anesthesia was given to the patient before? What type of surgery was carried out? Who was the surgeon? What type of orders were written by the surgeon? All this has to be assessed, okay, in the report. Along with that, if you want, you can also note down the indication of surgery, why the surgery was performed, or whether the person is having any history, medical history, okay, what type of medications they are taking, whether they have got any allergies, all that has to be checked. Next comes is in this intraoperative management. In intraoperative management, I know it is already done in the anesthesia room. Okay, that is during the time of surgery, all this will be done already. Okay, but you should always check the intraoperative care that is usually given to the patient. Okay, because you will come to know what type of anesthesia was given to the patient, and along with that you will know how much blood loss was there during surgery, what type of IV fluids were given during surgery, what was the intake, whether there was any complications in the anesthesia room, okay, or what type of laboratory investigations are written. Okay, all this in the anesthesia room, what has happened, that is whatever has happened in the OT, you have to read it, okay, to know what is the condition of the patient. So once you go through all these orders, you will come to know exactly what is the condition of the patient. So now next is initial assessment. So under initial assessment we have got assessing for airway, breathing and circulation. Okay. So this part we usually airway monitoring will come first actually. Okay. So this is the one. So airway, under that airway, now this is the latency of the airway. Okay. And see whether the person is able to breathe normally, whether there is requirement of an oral or nasal airway, or if the person pulse oximetry can be monitored, that is the oxygen saturation can be monitored. Then see for the requirement of ET tube, see whether the patient is on ET tube, what care will be given to the patient on ET. Usually regular suctioning has to be done, okay, because lot of secretions and collective suctioning may be necessary. Other than that, you have to assess the color of the skin, okay, both in the extremities as well as in the central region. Okay. Extremities in the sense here refers to the fingers and to the feet. You have to check for cyanosis, that is bluish discoloration. Along with that, you can also monitor the lips also for any bluish discoloration. Normally they are pink in color. Okay. Next is even you can check for pallor. Now pallor, bluish discoloration, or what I call as cyanosis, all this will indicate that patient is having very poor circulation. Okay. Along with that, you can start with some respiratory exercises, EBD exercises, coughing exercises, diaphragmatic exercises, incentive spirometry. I have explained about this in the last class. In detail, I will tell about the breathing and coughing exercise in the next PowerPoint. Next is breathing. Now, whenever breathing comes, you have to monitor the rate of breathing. What are the breath sounds? Whether normal breath sounds are there, or whether abnormal breath sounds are there, like rain, bronchi, wheezing is there. Okay, all that has to be assessed. Here for the quality of breathing, you can auscultate the breath sounds. Okay, if necessary, you can provide the oxygen administration. They may use face mask, face cannula, okay, any method. Next is assess the circulation. When you are assessing the circulation, what you have to do is you have to usually see for ECG, that is electrocardiogram. See the rhythm of ECG. See if there is any abnormal heart rate and heart rhythm. Abnormal heart rate and heart rhythm is called as arrhythmia or dysrhythmia. Okay. Along with that, monitor the blood pressure of the patient. So if you're monitoring the BP, you can see if it is very high or low. So most of the time, if the patient is hypotensive, he may go into shock. Even if the patient's BP is risen, that also is a problem. So you have to closely monitor the patient. Next comes is peripheral pulses. We have got a lot of peripheral pulses. I know that you have already studied this in foundations. So peripheral pulses, it could be of carotid, brachial, radial, dorsalis, pedis, femoral. All these pulses have to be assessed, both in the right side also, in the left side also. Okay. And see if there are any changes in the peripheral pulse. Next is when you are checking for the pulse, see the rate and rhythm of the pulse, whether it is rapid pulse, whether it is weak, or whether it is very, very feeble. Okay. Along with that, see the temperature of the skin. Just touch your fingers and assess the skin temperature of the skin. For example, if it is warm, means we know that there is adequate circulation. Okay. But if the skin is very cold and clammy, it will indicate that there is very, very poor blood circulation. Okay. Next is in neurological system, you have to see for the level of consciousness, whether the patient is conscious, whether his body is at time, place, and person. Just see for the sensory status. Sensory status means to touch, temperature, and all. Next is motor status. In motor status, you can ask the person to move in the extremities and all. Along with that, see whether the person is able to follow the instructions, whether he is confused or restless, whether he is agitated, whether he is having seizures, what we call as fits in common language. Other than that, if the patient is having coma also, you can do. Then we have got something called as GCH scale, that is Glasgow Coma Scale or Neurochart. That also has to be monitored in neurological system. Comes is genitourinary. Under that, you have to monitor the intake output of the patient. How much fluids were given, what type of IV fluids were given, whether total variable nutrition was given, then what medications were given, what is the output, what is the output in the drain, what is the color of the output. Everything has to be recorded. Next comes the surgical site. Observe the surgical site very, very carefully because there can be excess bleeding, there can be excess soakage. Okay. And whenever you are doing the dressing, perform it in aseptic technique. Okay. And along with that, you can ask if the patient is having any sort of pain or what. Next is moving on to cardiovascular system. So under cardiovascular, as I have already mentioned, you have to monitor the blood pressure, see for the circulation and all. Okay. So when you're monitoring the BP, you have to check for hypertension, hypotension. Okay. So that can be monitored usually. This I have already explained them. Then see whether there is increased heart rate or decreased heart rate. Okay. Increased heart rate refers to a tachycardia. Decreased refers to a bradycardia. Dysrhythmias or arrhythmias means abnormal heart rate or heart rhythm. In integumentary system, you have to monitor for any cyanosis. Cyanosis means bluish discoloration of the skin and mucous membrane. Then you should also monitor for capillary leakage. Okay. So that we will usually show you when I am doing cardiovascular assessment, or sometimes in integumentary also I will show you how to just press your nail bed. Okay. And when you are pressing and after a few seconds you have to release, you will see that within 1 to 2 seconds the blood circulation has returned back. Okay, so that is referred as capillary refill. Along with that, you should see the skin. See whether the skin is moist or dehydrated. Okay. What is the skin color? All that can be assessed. Next comes the respiratory system. Under that, you should see whether the patient is using what type of muscles for respiration, whether accessory muscles are used, whether the person is having any breathing difficulty or dyspnea, whether there are what are the breath sounds, whether it is abnormal or normal. Okay. What is the ABG, whether it is normal or abnormal, oxygen saturation, rate or nature of respiration, all that has to be assessed in respiratory system. Next is renal. already I have almost told. Normally, the urine output has to be 0.5 ml per kg per hour. Okay. So if it is less than that, you will have to immediately inform the physician. You may have to undergo dialysis or other things. Okay. And give adequate fluids to the patient only after the advice by the surgeon, and then you have to assess for bladder distension. Okay. So bladder distension is usually present when the person is not able to empty his bladder. Okay. Usually during the time of urine retention, it is commonly seen. Next is assessment of surgical site drainage tube. Then how much IV fluids are given, what is the sensation of extremity, whether it is normal, level of consciousness, what is the pain status. You have to use the pain scale. Okay. Okay, there are lots of different types of pain scales, numerical pain scale and all these rating scales are there. So you can use any type of pain scale. You have to also monitor the bubble sounds. Okay. Get the intake output and see the blood loss in the. Next is monitor the body temperature. Monitoring the body temperature here refers whether the person is having fever, that is hyperthermia or hypothermia. Hypothermia means body temperature is going low. In that case, you can provide blankets to the patient and keep the patient warm. Okay, if the patient is on IV fluids, stop the IV fluids for some time. If the patient is on hyperthermia, you have to find out what is the reason behind it. Most of the time, fever is seen after your infection and all. Okay. So next comes is positioning the patient. Now, what type of position you have to give to the patient, it all depends on the type of the surgery. Okay. And most of the time, you may need to give sideline position to drain out all the secretions. Sometimes we may need head and elevation also. Okay. And if there are lots of secretions, patient is not able to cough and remove the secretion, then you have to perform suctioning. If required, you can also use artificial airway to prevent tongue from falling back. Next up, if oxygen saturation is dropped, if ABG analysis is showing there is poor circulation, you can start or keep the patient on mechanical ventilation also. Next is I have already repeated, assessing the wound condition, see the drains, dressing. You can teach deep breathing and coughing exercise, incentive spirometry, about that I have already told in the last class. Then you can teach active or passive exercises. You can start physiotherapy, okay? Or you can also start with respiratory therapy, just physiotherapy and all. And early ambulation is very essential. Okay? If after the surgery, you should never tell to the patient that you have to take bed rest for 1 to 2 months. No. After the surgery, after the consultation from the surgeon, the patient will have to start early ambulation, that is leg exercises. First they will start with passive exercise, then they will start with active exercises. Okay, foot and leg exercises are usually given to prevent deep vein thrombosis and venous stasis. Okay. So we'll see what is all that later in the later slides it is coming. And after that, deep vein thrombosis is actually a clot formation in the deep veins. Okay, commonly it is seen in the leg. So to prevent this deep vein thrombosis or clot in the extremities, you have to give some anticoagulants. Anticoagulants means blood thinners like your heparin, warfarin can be started. And other than that, you may need to start with antibiotics. Antibiotics here refers to your medications that are given or drugs that are given to reduce the infection or to prevent infection. Okay, and always you have to keep monitoring your blood pressure as well as your blood sugars. Okay, after the surgery, what happens is if blood sugars are not under control, the wound will not heal properly. Next is monitor for nausea and vomiting. Then check for any potential complications like deep vein thrombosis, shortness of breath. Okay, then wound infection, UTI, that is urinary tract infection, then pulmonary emboli. This is all I will discuss in the complications. Okay, then intestinal obstruction. Okay, shock, atelectasis, airway obstruction, pneumonia. All these are actually the complications in the post-operative period. So I will discuss in detail all of this. Okay, so all that potential complications has to be assessed. Then next is in the post-operative period, you can provide analgesics to the patient to reduce the pain. You can use physical therapies, okay, to divert the person from pain and all, then provide a comfortable position. Next is assess the skin color to see if the patient is hydrated or not. Then see if there is excess thirst. Excess thirst means patient is dehydrated. Check for distended neck veins. That also will show abnormalities. Next is swelling. Maybe swelling of the feet and all has to be assessed. Then peristalsis. Okay. Whether the bowel sounds are returning or not. Whether the patient is having constipation, diarrhea, what type of diet patient is in need of. Okay. So those are particularly about the post-operative care. Again, we will continue the post-operative orders. So under post-operative orders, same thing repetition. I will tell it fast. There is no need to explain much here. Okay. You have to monitor vital signs, temperature, pulse, blood pressure, pulse oximeter, ECG, intake output, okay, ABG, all the level of consciousness has to be monitored. Under respiratory care, oxygen can be given, ventilator has to be provided if they are not able to breathe well, suctioning has to be done, and chest physiotherapy. Next is positioning. See what is the correct positioning. Change the position of the patient at least every 30 minutes. Okay. And you have to prevent the occurrence of deep vein thrombosis. Okay. Next is regarding diet. I this also have already explained. Initially patient is NPO. Then you will start with liquids. Then you will start with semi-solid or soft diet. Then you can start with the normal diet. The next is administering IV fluids. So initially patient is not taking anything orally. So IV fluids are given to the patient. Okay. So see that care has to be taken of this site. Sometimes patient may be on some stomas like jejunostomy, gastrostomy and all. With the stoma you may be feeding the patient or there may be drains. So all this has to be assessed. Next is drugs. Now certain medications will be taken in the post-operative period. All that depends upon the surgery what is done. Okay. Now antibiotics are usually given to prevent infection. Painkillers are given or analgesics are given to reduce the pain. Sedatives are given to induce sleep. Then we have also got H2 receptor antagonists or H2 blockers, that is histamine blockers. They are usually given to reduce the activity of your hydrochloric acid. Okay. Next is anticoagulants most of the time to prevent the clot formations and all. Antidiabetic tablets or oral hypoglycemic agents are given only to those people who are having diabetes mellitus. Antihypertensives are usually given to treat hypertension, okay, to lower your blood pressure. Then frequently, even after the surgery, you have to conduct diagnostic procedures or laboratory studies. Next is nurse's role. What is the role of nurse in post-operative ward? Okay, what is the role of nurse in PSCU? There are so many roles of a nurse, isn't it? She has to provide intensive care to the patient. A comprehensive care has to be provided to the patient. She has to monitor IV lines. She has to give irrigations. She has to see the infusions, the catheters, wound drains. Then along with that, she has to also assess the surgical site, see the type of dressings, what is the amount of drain in the dressings. Along with that, not only initial assessment, she has to also perform ongoing assessment, perform diagnosis and intervention. Then she has to also monitor the vital signs. This already I have discussed. Next is she has to see the level of consciousness of the patient or check the orientation of the patient, whether he is oriented to time, place and person. Like asking what is your name, where are you, what are you doing. Okay. Then maintaining intake output. Again, I will not explain it in detail. Okay. Then next role of the nurse will be protecting the airway. Here you can see the different type of airways. Okay. Oral airway and all can be used. It can be usually used to prevent tongue from falling back. Then if necessary you can start with oxygen therapy and all. therapy is usually given to prevent dehydration. Sometimes during the time of surgery, the patient may have excess of blood loss. In that case, you can give a blood transfusion. Okay, the transfusion can be started where you are giving blood products to the patient. Then again here also you have to monitor intake output, keep the patient warm and monitor the vital signs of the patient and prevent the patient from shock, whether it is due to hypotension or hypovolemic shock. Now, if the patient is going into shock, what you should do? Immediately what you have to do is you have to elevate the feet of the patient. You can see here in the figure, feet of the patient is kept elevated and the head should be lowered. Okay. So immediately what happens is because of adequate blood circulation to your brain and other vital organs, he may return to normal. Okay. So remember, in case of shock, you have to keep the patient's feet elevated. Next is the nurse has to assess the surgical site. Assessing the surgical site first of all for bleeding. Bleeding means hemorrhage. Okay. So see the site, whether there is bleeding from the site, what is the HB level of the patient. Okay, if there is excess of bleeding, pain or redness, immediately inform the physician. Okay, then these are the same things what I have already told. Next one is, if the patient is having hypothermia, what you have to do is you can provide the blankets, you can provide warmer, or you can also use this bear hugger you can see. Okay, so this type of machine is delivered in some hot area. Okay. That also can be used in the post-operative part. Then relieving pain and anxiety is very essential in the post-operative period because the patient will be very anxious whether they are going to recover or not. So in that case, what you have to do is you can provide analgesics, reduce the fear and anxiety, you can clear the doubt of the patients. Okay. Provide psychological support. You can also provide the non-steroidal anti-inflammatory drugs, means NSAIDs or epidural analgesia. Follow the doctor's order. Next is, sometimes what happens is after the surgery, the patients can have nausea and vomiting. Sometimes it is seen after general anesthesia. So you can give antiemetics. This is the example of all antiemetics: ondansetron, metoclopramide. Okay, antiemetics means drugs which reduce or prevent nausea and vomiting. Next is, prepare the patient for discharge once he is stable. Okay, check the oxygen saturation, urine output, pain, respiratory function, cardiovascular function. All that you have to assess. Most of the time they are using one score that is called as Algid score. Okay, once you are shifting the patient from the PNCO, you will use that Algid score to score the patient to see what is the condition of the patient. So this is the example of Algid score. It is not necessary, not essential to write for the exam. Just for your knowledge. In Algid score, there is circulation, consciousness, color, respiration, activity. Okay, and what is the circulation that you are supposed to mark there? Consciousness that you have to mark, whether fully awake, erosible that you mark. In color, whether the skin is warm or dry, pale, pallor, whether it is cyanotic, that you have to mark. Respiration, whether the patient is having dyspnea, whether he is able to breathe normally, all that has to be written. The next is activity, whether the person is able to move. Okay, all such things has to be marked in this Albrecht score. Next is patient teaching. Now, teaching the patient elements will include regarding exercise, food care, regarding medications, discharge advice, follow-up, activity, what type of nutrition should be taken. All that will be taught by the nurse. Okay, so remaining things are actually repetitions. Next is in the position that is usually given to the patient during recovery from general anesthesia. Okay. Next is regarding teaching deep breathing and coughing exercises. Now, why you are doing this is, it is most of the time deep breathing exercise will facilitate gas exchange. Okay. Deep breathing exercise will facilitate gas exchange and it will usually prevent this alveolar collapse. It will prevent the collapse of the alveoli and it will help in removing the secretions most of the time. Okay. And see that the patient should be encouraged to breathe deeply 10 times every hour. Okay. So always remember, deep breathing is very essential after the surgery. Okay. And then instead can be given. Why deep breathing is essential? Most of the time, after the pain is there, what you will do, you will breathe shallow. If shallow breathing is continued for longer time, you will not get adequate oxygen. Okay. So to prevent that, we have to encourage the patient to take deep breaths. Next is diaphragmatic or abdominal breathing. Now, diaphragmatic or abdominal breathing is accomplished by inhaling very slowly and deeply through the nose. Okay, you can sit comfortably, take a deep breath, which is slow through the nose, hold the breath for a few seconds, then exhale through the mouth. That is referred as one type of diaphragmatic or abdominal breathing. Okay, sit in a peaceful position. Take a slow and deep breath, hold the breath for a few seconds, and then you can exhale it through the mouth. Okay, next is the patient's hand should be placed slightly over the lower legs and upper abdomen. This allows the patient to feel the abdomen rise during inspiration and fall during expiration. Okay, so that is also one particular way in which you can reach your patient. Next is effective coughing exercises have to be done. There are a lot of coughing exercises. I will teach about it later. So these coughing exercises will help to reduce or remove the secretions. Okay, and always advise the patient to split the surgical site while they are coughing. For example, here you can see in the figure. You have to hold the hand. You can hold a pillow also against the surgical side while you are coughing, so that there is no increase in the abdominal pressure. Next is nursing diagnosis. Nursing diagnosis you can frame according to your patient's condition. Okay, I have just framed some nursing diagnosis in effective airway clearance, ineffective breathing patterns, impaired gas exchange, and aspiration. Next is moving on to the complications that is seen in the post-operative period. In post-operative period, we are going to see certain complications immediately. Sometimes early post-operative period you can see complications. Sometimes throughout the post-operative period also you can see the complications. So that is why close monitoring of the patient is very essential. Okay, so in the post-operative period. So here you can see in the figure, the patient is connected to so many monitors here, isn't it? Then these are some general post-operative problems. I'll just read out the name. I'll discuss regarding it in detail. Okay, like in the post-operative period, patient can have complications like pain, problem in nutrition, nausea and vomiting, bleeding or hemorrhage, DVT, deep vein thrombosis, hypothermia. Because of that, they may shiver, hyperthermia or fever. They can also have pressure sores or decubitus ulcer, confusion. There may be brains, poor wound care. There may be wound dehiscence or wound evisceration. Okay, all this will be some major problems that will be seen in the post-operative period. Other than that, system-wise, you can see these are the complications of post-operative period. It is important. In the neurology, you can see pain, fever, delirium, hypothermia. We will discuss about it. Okay. In urinary, you can see urine retention and infection. In GI, nausea, vomiting, abdomen distension, flatulence, paralytic ileus, hiccups, delayed gastric emptying with this stomach flu, food and fluids will not empty quickly. Respiratory, you can see airway obstruction, atelectasis, pneumonia, hypoxemia, aspiration of vomitus. Articles, you can see arrhythmias or dysrhythmias, bleeding or hemorrhage, low BP, hypertension, pulmonary embolism. In integumentary, you can see skin infection, bleeding, wound dehiscence and evisceration, keloids. In fluid and electrolyte, you can see overload, fluid deficient. Okay. So this is also repetition of the complications. I have just taken the figure. And the respiratory complications, first one we have got is airway obstruction. Now airway obstruction means it is a blockage to the airway. It could be because of tongue from falling back, okay, or it could be because of some secretions, or because of laryngospasm or edema of the larynx. Okay, so these are the causes of airway obstruction. So what you have to do is immediately you have to assess the breath sounds and all, and start with oxygenation or start keep the patient on ventilator. Next one is hypoxemia. Hypoxemia specifically, it is a partial pressure of arterial oxygenation which is less than 60 of Hg. Okay, and usually here in case of hypoxemia, the person can have various signs and symptoms. Okay, they can have hypotension, then tachycardia or sometimes bradycardia also. Okay, so that is particularly seen in hypoxemia. Sometimes hypoxemia is also referred as low level of oxygen in the blood. Next is atelectasis. Atelectasis means it is complete or partial collapse of the lungs. Why atelectasis happens post-operative period? It could be because of improper ventilatory function or decreased respiratory function or excess of retained secretions will cause atelectasis or collapse of lung. Next one is pulmonary edema. Pulmonary edema means what? Pulmonary edema, it is a condition in which fluids accumulate in the lungs. Okay? There will be extravasation of fluid from the pulmonary vasculature into the interstitial and alveoli of the lungs. Okay? So that is called as pulmonary edema, where fluid will accumulate in the lungs. Okay? That is in the alveoli. And particularly it may result in ventricular failure, it may cause sepsis, aspiration, airway obstruction and all. And pulmonary edema is characterized by usually the patient will have abnormal breath sounds like crackles on auscultation. Those things are usually seen, and abnormal is exgested phase also seen in the patient. Okay. So hypoxemia is that immediately you can start with oxygen therapy, keep the patient on ventilatory support after the intubation. Next is bronchospasm. Bronchospasm is the result of increase in bronchial smooth muscle tone with resultant closure of small airways. Okay. So here the bronchus will be undergoing a spasm because of the inflammation. Next is cardiovascular problems. I have not explained this. Hypertension, arrhythmias, DVT, pulmonary embolism and syncope. Hypotension means low blood pressure. It can be seen because of shock, because of dehydration, excess of vomiting and all. Hypertension means increased blood pressure. Okay, that is also seen in the post-operative period. Sometimes patient can have arrhythmias, abnormal heart rate and heart rhythm. Next one is deep vein thrombosis. Under deep vein thrombosis, what happens here? You can see in the figure. Deep vein thrombosis means thrombus in the deep vein. That is clot in the deep vein, especially it is seen in the leg. Okay? They will have lot of swelling, redness, pain will be present. So to avoid or prevent DVT, early ambulation should be started. That is, you can start with passive exercises, physiotherapy and all. Please always remember it is a major complication where usually the page will be, especially the back muscle region will have redness and pain. Next one is pulmonary embolism. Okay? A pulmonary embolism is also usually seen in the patients because of the clot formation or because of the thrombus formation. This emboli can dislodge in the pulmonary artery or in the pulmonary veins, and it can result in decreased blood circulation to your heart and lungs. Next one is syncope. Syncope means temporary loss of consciousness. Now, why syncope happens after surgery? It could be because of hypotension or because of excess of bleeding also. So, you have to assess what is the cause of syncope. You can monitor the blood pressure of the patient also. Next one is neurological problems. So most of the time after the surgery, if the patient has received general anesthesia, the patient can have confusion, anxiety, disorientation. They can also have depression and excess of pain. So you have to assess the psychological status of the patient and you have to provide care to the patient. Okay. So usually this delirium is a condition in which the patient will be very much confused. They will be disturbed, they will be restless. Okay, it is referred to as organic mental disorder where the person will have impaired consciousness, they will be disoriented. Okay, and for this delirium, usually they will be receiving this benzodiazepines and psychotics. These are certain drugs that are given. We will study delirium topic in third year in psychiatry. Okay. Along with that, the patients can also have GI problems. Under GI problems, the patient can have nausea and vomiting, especially if they have undergone this general anesthesia. In that case, they can have nausea and vomiting. Okay? And sometimes what happens is, if the patient has taken some food or fluid and all, chances are there that they may be aspirated. Okay? So aspiration can happen into the lungs. The food and fluids may be aspirated into the lungs. Sometimes secretions can be aspirated into the lungs. And that in turn can result in aspiration pneumonia. That is a respiratory problem. Okay? So these type of problems can be usually prevented. So always assess for these complications in the post-operative period. And abdominal distension and or bladder distension sometimes can be seen if the patient is not able to pass the urine. Okay, and then constipation. Why constipation is seen post-operatively? It could be because patient is not taking adequate roughage, or fluids are not taken, or because patient is staying in the hospital. So assess if the patient is having constipation. Next one is hiccups. Now, these hiccups can be seen usually after your general anesthesia, and sometimes it could be because of some mild injury or toxins or trauma and all. So to prevent these hiccups soon after the surgery, you can give them some little ice cold water. We can ask the patient to hold the breath, or gentle pressure can be given on the diaphragm, so it can reduce the cough. Next is urinary problems. In urinary problems, patient can have low urine output. Okay, they can have low urine output. Sometimes they can have polyuria also. Okay. And sometimes there can be urine retention because initially the patient may be on catheter. Is once you are removing the diabolis catheter, chances are there that they may not pass urine. Okay, so that may result in abdominal distension also. So this is particularly about the complications of your in post-operative period. Okay. In cardiovascular, as I have told, patient can have hypertension, hypotension, arrhythmias, that is abnormal heart rate and heart rhythm. Okay. And along with that, in the skin, they can have keloids. Okay. That you will see in worms. Keloids means irregular fibrous tissue at the arm during the injury. Okay. So remember, under it usually comes under this integumental system. Okay, under integumental system we will have keloids. Okay, so keloids means irregular fibrous tissue that is seen because of a scar after the injury. Suppose you have got some injury or trauma in your leg or anywhere in the part of the body. If it was somewhat a large injury, you will see that even after months or years after healing, something is formed, isn't it? Some scar tissue is formed. Sometimes what happens is after burns, injury and all, there will be an excess of granulation tissue that can result in keloid formation. Okay, so that was particularly about your post-operative